Hello everyone, I am Dr. Reema Sircar. I am a fertility and IVF specialist with Indira IVF at the Dehradun Center. Hope all of you are taking good care of yourself during these COVID times. Friends, festival season is round the corner, and as a doctor, I want to remind you all that coronavirus is not gone yet. Please do not let your guards down during these festivals and keep taking all the required precautions. Today, in this session, I am going to talk about various myths associated with IVF treatment. In all these 15-16 years of my practice, I have met hundreds of couples who came to ask for treatment of infertility. It may sound strange that in a country fighting with overpopulation, there may be a few couples who actually struggle to have children. Unfortunately, infertility is a reality and it is very common too. It saddens me to see that only just a fraction of needy people are able to benefit from the plethora of treatments available nowadays. Lack of correct information and propagation of myths by word of mouth is a very big hindrance which stops people from availing the correct treatment. I'll talk about a few common myths that I've heard from my patients again and time and again, and also I'll try and present correct facts related to these topics. Starting with the myth number 1. Many people believe that IVF is not a natural process, and so the baby that will result will also not be normal and could be malformed. This, however, is not true. IVF is merely a replication of the natural process of fertilization. I'll just explain it how. Let's just consider this couple in whom the fallopian tubes in the woman are blocked. Now, no matter how good an egg the woman partner might have, no matter how good a sperm the male partner might have, if there is a blockage in the fallopian tubes, this egg and the sperm cannot meet, and hence the baby will not be formed, and this couple will now keep suffering from infertility unless they go in for IVF. What is it that we do in IVF? We give hormonal injections to the woman so as to get her eggs matured. Once matured, we give a small anesthesia to the woman, put in a thin needle into her ovary, and bring her eggs out of her body to our lab. Now we have her eggs in our lab. We ask the husband to give semen sample, and then we keep these eggs and sperms together, providing them a favorable environment to be able to meet. So now fertilization that was supposed to occur in the body has now occurred outside the body in our lab. The procedure, however, stayed the same. Once a baby is formed, now it can be transferred back into the uterus of the mother. Every step is done exactly how it happens in nature, in the body, making it just an assisted procedure, which would now help these otherwise infertile couples to become parents. There is nothing synthetic or artificial about the procedure. In fact, once the baby is transferred back into the uterus, an IVF pregnancy would proceed just like any other naturally conceived one. Also, the risk of baby being anomalous is just as high or just as low as anyone who's conceived naturally without IVF. So myth number 1 busted. Secondly, I have noticed that the couples who come, they come with this preconceived notion that IVF should be the last resort for infertility treatment. And in fact, some of them really insist that firstly they should be given some medicines to eat or some injections, and once these fail, then IUI should be done, and only once everything else has failed, then only maybe IVF can be thought of. Now this is completely false and unscientific. For example, like in this patient with both the tubes blocked, even if we keep giving medicines, the egg and sperm cannot meet. and so IVF will be the only treatment of choice no matter the age of the patient. Any other treatment in such cases would be a wastage of time, energy and resources because it will not result in pregnancy. So the treatment plan should depend upon the cause of infertility and will vary from couple to couple. Another myth about IVF is that it is a very costly treatment and is meant only for the rich people. Not everyone can afford it. Now this is only partially correct. A few years back, I agree that one cycle of IVF used to cost around 4 to 5 lakhs. However, with more and more people now moving towards IVF and with the availability of better and newer technologies, not only the cost of IVF per cycle has come down, but also the average income and paying capacity of people has also increased in general, making it well within the reach of most of the people. Also, when you compare the treatment cost of IVF with other treatment modalities like any cardiac surgery or a joint replacement surgery or maybe in some aesthetic surgery, this actually is much cheaper and economical. Another wrong belief that I have noticed that many people believe that IVF is a very painful procedure. This again is not true. The injections that we give during IVF are not painful. The procedure of egg retrieval is done under anesthesia and the embryo transfer procedure is just like any other gynec examination. So IVF is actually not a painful procedure. Many people believe that IVF, once it is done, then the baby will not be their own and they will only have either twins or triplets. Now neither of these beliefs is true. Let me explain. IVF clinics do have to proceed with donor programs in some of the cases, which can be either an egg or a sperm or an embryo donation. But these are for the couples who have problems like where they do not have their own eggs or their sperms because of any reason. Their sperms or eggs might be depleted. However, if the couple do have their own healthy gametes, IVF is carried out using their own eggs and sperms only. This is very important to understand because it's a wrong belief. Now regarding twins and triplets, yes, I do agree that the chances of multiple pregnancy do increase with IVF, but this depends upon the number of the embryos transferred, and so this must be discussed with the doctor before the transfer. So many of the standard and good IVF clinics are in fact nowadays moving on to the practice of what we call as SCT or single embryo transfer. The best embryo that is formed is transferred and rest are frozen for subsequent use in case one needs it. Of course, availability of good freezing techniques at the clinic are a prerequisite here, so no need to be anxious about that part also. Lastly, a very illogical and common belief that patients and their relatives carry is the need for bed rest after IVF. This is completely false that patients cannot lead a normal life after IVF is done and they need to be on complete bed rest. In fact, we encourage all our IVF patients to stay as normal as possible and continue with all the light physical activities also. We've had so many working career women undergoing IVF and none of them had to give up their jobs. Of course, pregnancy as it is does require some extra caution and care, but just because the pregnancy came after IVF is absolutely no reason to put an otherwise completely healthy, active person on bed. No, that is not required and we do not encourage it. So now we see that IVF actually is a safe, affordable, painless and a scientific way to achieve pregnancy in couples who could not do so naturally. Please do not shy away from such a beautiful miracle of science just because of a few myths and false beliefs. Be aware, be smart, complete your family in time, and enjoy a blissful family life. For any free consultation with any of our fertility experts, you can dial on one of the numbers that is being flashed on the screen.